sex workers, and the LGBTQIA+ community. By prioritizing equity and inclusion, we can create systems that protect and empower everyone. We continue to make significant improvements in HIV testing. We make improvements in treatment and care through expanded access to antiretroviral therapy and innovative community-led efforts. 3 weeks ago, our Health Minister, Dr. Aaron Motsoaledi, launched the 6 MMD. In other words, 6-month, multi-month dispensing. This was done in Bloemfontein. This approach allows stable patients to receive a 6-month supply of ARVs in one clinic visit, reducing clinic visits, saving time and transportation costs, and alleviating the workload at healthcare facilities. The result will improve treatment adherence and patients' outcome, contributing to achieving the second 95 target. Compatriots, South Africa faces a dual epidemic of HIV and tuberculosis. The Global Tuberculosis Report of the World Health Organization of 2025, released last month, shows that tuberculosis continues to be the world's top infectious killer disease. In 2024, tuberculosis claimed the lives of 1.2 million individuals worldwide, with 54,000 fatalities in South Africa alone. Despite a 61% reduction in tuberculosis incidence in South Africa from 2015 to 2024, the struggle against the disease continues. We need to end TB. In line with this objective, on March 24 this year, during the World TB commemorative event in KwaZulu-Natal, I launched the End TB campaign with the goal of testing 5 million individuals annually for tuberculosis, highlighting the urgency of combating the disease for its eradication. Subsequently, Minister of Health, Dr. Motsoaledi, launched the TB dashboard to allow stakeholders to monitor the campaign's progress by having access to near real-time data. To date, this campaign has reached 1.8 million people, representing 62% of the target assigned from April the 1st to September the 30th of this year. The National Department of Health has introduced a novel 6-month regimen for patients with multi-drug resistant tuberculosis, significantly shorter than the previous treatments of 9, 18, or 24 months. This new regimen has achieved an unprecedented treatment success of close to 80%, surpassing the target of 75% of drug-resistant TB patients. We are performing well against national and global targets. Another shorter, much more friendly treatment regimen of 4 months was also introduced for children. We look forward to further refinements in treatment outcomes amongst specifically children receiving newer TB treatments in our health facilities. Fellow South Africans, 2025 marks 2 decades since the introduction of life-saving antiretroviral therapy, ARVs. Prior to this policy shift in the early 2000s, HIV was a fatal disease with significant mortality, affecting over 500,000 lives and reducing life expectancy to just 54 years. The introduction of ARVs transformed this narrative, starting with the first pill administered in Khayelitsha in Cape Town, heralding a miraculous change. Mothers initially given a terminal diagnosis have experienced health improvements, witnessing their children graduate and becoming grandmothers. Children thought unlikely to reach grade 1 are now thriving at 21, flourishing in tertiary education. ARVs have reduced vertical transmission of HIV to below 2% in South Africa, allowing children born to HIV-positive mothers to achieve healthy milestones. And this is what Ubuntu means when it becomes policy. Fellow South Africans, we hold this commemoration against the backdrop of a successful G20 summit. One of the key activities on the sidelines of the G20 was the Global Fund Aid Replenishment Summit. The event was co-hosted by South Africa and the United Kingdom, led by His Excellency President Cyril Ramaphosa and His Excellency Prime Minister Keir Starmer of the United Kingdom. The 8th replenishment campaigns aim to raise a total of 18 billion US dollars to fund the GC8 grant cycle from 2027 to 2029. The objective is to save up to 23 million lives, enhance health systems, and accelerate efforts against HIV, TB, and malaria. Pledges amounting to 11.3 billion US dollars were raised globally, with significant contributions from the African continent, the largest recipient of the Global Fund resources. South Africa pledged 36.6 million US dollars through a public-private partnership between DERCO, National Department of Health, Anglo-American, and Goodbye Malaria. South Africa has been a major beneficiary of the Global Fund to the tune of 2.3 billion US dollars over the years. Most recently, it secured 400 million US dollars for Grant Cycle 7, which started on the 1st of October this year and will run until the 31st of March 2028. On this World AIDS Day, we celebrate the incredible progress that has transformed HIV from a death sentence into a condition that can be managed with dignity and hope. Yet our mission is far from over. Today we stand at a defining moment where science, compassion, and unwavering resolve can unite to end an epidemic that has cast its shadow for many years. We are on the verge of a significant advancement in the prevention revolution. Lenacapavir is a groundbreaking long-acting prevention technology that provides 100% protection for up to 6 months with just 1 injection and requires only 2 injections per year, which will significantly enhance how individuals protect themselves in the next generation. This innovation has profound implications for South Africa. It offers hope for young women who cannot negotiate condom use. It empowers adults and girls navigating relationships marked by power imbalances. It provides protection for key populations who face stigma and discrimination. It supports workers and learners who struggle with the burden of daily pill adherence. In other words, Lenacapavir speaks to the reality of our people's lives, that preventions must be practical, dignified, discreet, and compatible with the pressures of daily life. We collaborated with SAPRA to achieve regulatory readiness, making our regulator the first in Africa and third globally to register Lenacapavir. Additionally, we are engaging with various stakeholders to explore local manufacturing opportunities, emphasizing the importance of active participation in developing prevention tools to avoid relying on global supply chains. Program directors, let me be clear. We cannot repeat the mistakes of the early ARV era, where life-saving tools reached our shores too slowly. This time, we move with agency, with foresight, and with unity. Lenacapavir is not just a drug. It is a symbol of what becomes possible when science, political will, and community demand meet at the same table. To close the 1.1 million gap and prepare for long-active prevention, we must critically examine our efforts towards marginalized communities and our willingness to embrace new scientific advancements. Key considerations include ensuring accessibility, affordability, and sustainability, alongside a commitment to a future without HIV transmission at birth or resulting adult death from the virus. As I conclude, program directors, let us confront stigma with courage. Let us ensure that we fund research and ensure that treatment reaches everyone. This is a commitment to health, to dignity, to justice, and equality for all people. Let us rise to this challenge together, renewed, resilient, and resolute, aligned to South Africa's World AIDS theme for 2025, which is renewed efforts and sustainable commitments to end AIDS. With those few words, I would like to thank everyone and make sure that we continue this fight together. Akhensa inkomo.